At some point in life, we all need a little help. And for families who are suffering medical crises, There With Care is a nonprofit that's working to bring both community and assistance to those in need to help ease the burden of life's day-to-day obligations. Joining me now to discuss more is There With Care's Executive Director, Kathy Hansen Sweeny. Kathy, thank you so much for joining us today.
Thank you, Olivia. Thank you for having us.
Yes.
It's a pleasure to be here. Having a child with a critically ill child is a devastating reality for thousands of families every year.
Absolutely.
Once a child is diagnosed with a critical diagnosis, it impacts the wholeness of the entire family. Often one family may have to quit work. There's financial distress, navigating the healthcare system, constant stress, and them losing their sense of normal community. So that's where There With Care comes in to help ease the burden of life's day-to-day challenges for these families. Like you said, we provide a wide range of thoughtful and meaningful services to these families at the critical time of their lives when they have this diagnosis. Typically for us, that's about 3 months. And then we do that through partnering with local hospitals here in the Bay Area, Lucille Packard Children's Hospital at Stanford, and UCSF Benioff Children's Hospital at Mission Bay. And their social workers are really our true partners. They refer families to us, and once those families are referred to our organization, our program team members reach out to them to try to find out what kind of services and help that they might need. And then we begin to provide that care to them through our core. We have a core of 350 volunteers, as well as school groups, organizations, corporations who really come together to either donate items for our care packages, help us purchase those, assemble them, and also deliver them.
Amazing. Well, let's get into some of the details. So thank you so much for establishing what There With Care is. Now I'm sure our audience can really take part in this conversation. So thank you so much for that. So you established what There With Care is, but let's kind of rewind it back a little bit. What exactly are some of the programs and services that There With Care does provide? Because when you hear families in financial need, medical crises, we don't always know what that means.
Yep, sure, great question. So we really narrow it down into 4 programmatic areas. We provide transportation assistance, housing stability, we provide home stability as well, and also patient and sibling support for the entire family. So we really want to support the entire family in whatever they might need at that time.
It's amazing that you guys do so many efforts to help these families, because in times of medical crises, you often don't have a lot of help. So thank you for the service that There With Care is doing. And it's not just here in the Bay Area. You guys have actually helped over 10,000 families throughout really the entire country. Can you tell me a little bit more about that?
Sure. We were founded in 2005 by Paula Dupree-Pesman. She's our founder and our current CEO. She resides in Colorado. So we have locations in Denver and Boulder and Middle Tennessee, and then here in the Bay Area. So I'm the executive director of the Bay Area chapter of There With Care. And in total, we have served this year 10,000 families.
Oh my gosh.
In the Bay Area, it's about 3,400 families, and this year is 600 families. So we're currently at 500, so we're getting close.
You guys are doing so incredible. And Kathy, being the executive director over here in the Bay Area, what are you hearing in responses from the families who are receiving some of this assistance and going through these medical crises?
Well, many of our families don't always live in the Bay Area. They come into these areas to have their child seen at one of the children's hospitals. So they're home away from home. They're staying either at Ronald McDonald House near Stanford or Family House here at UCSF Benioff. So really the essential services that we can provide to them are easy meals. Transportation is really a big one. Housing, we'd love to deepen our care for housing assistance for many of these families. So those are some of the main ones.
Those are some of the main things that you're getting, responses that you're getting from families. And what is the help maybe that There With Care needs from others? How can people help donate or even maybe take part in There With Care?
We have a comprehensive website called therewithcare.org, and you can go there and select actually Bay Area chapter, and we have many ways people can get involved. It's volunteering, they can donate philanthropically, they can purchase items that can go into our care packages. We have our wish lists posted on our website. They always can contact us as well. We'd love to deepen our volunteer base in San Francisco, and that's another way people can get involved as well.
And are these some of the packages that people would be receiving if they were, to be able to
These
participate?
are, yes. We brought I brought some examples here. We have our Easy Meal Care Bag, which is a really popular one, as many families are bedside, home away from home, or at Ronald McDonald House or Family House. We have our patient and sibling support. So we do support, as I said, the whole family. So we provide games and toys for other siblings who are here with their brother or sister. We have a holiday during the holidays, which is a special time, as we all know, but for our families, we try to provide some extra care and support for them. And so these types of care bags are just done around the holidays by some of our volunteers. This is a Thanksgiving one, and it has, blankets, extra food, kind of comforts of the holiday. We also have our toiletry bag, which is something that is also in high need of, as parents have to pick up and leave. A baby care bag, which is something that's really important for us because over 50% of the families we serve are NICU babies.
Oh, wow.
So preterm or premature. So that's a really helpful package that we can provide care to families.
Well, these are just incredible things that you guys are doing. It sounds like you cover every single base. So thank you so much, Kathy, for joining us.
Thank you, Olivia. Thank you.
Appreciate it. Of course.